Dementia isn't just an old age problem, it can start much earlier. Today, I'm revealing 6 early signs of dementia that you simply can't ignore. With dementia impacting over 55 million people globally, catching it early is crucial, even if you're young. This video is split into 3 key sections. First, the 6 subtle early signs of dementia. Next, the 10 classic symptoms you should be aware of. And finally, tips on prevention and the latest hopeful advancements. If you find this info valuable, hit like, share with friends, and drop a comment below to help others stay informed. So, what exactly is dementia? At its core, dementia isn't a single disease, but rather a collection of symptoms that result from damage to the brain caused by various diseases. It primarily affects cognitive abilities, including memory, thinking, problem-solving, and even language. Imagine your brain as a complex network of wires. Dementia starts to fray those wires, leading to disruptions in how you think, remember, and communicate. These disruptions can range from mild forgetfulness to severe memory loss and confusion, gradually interfering with daily life and independence. It's a progressive condition, meaning it worsens over time, and understanding its impact is crucial for both those affected and their loved ones. Types of dementia. There are several types of dementia, each with its own unique characteristics and causes. The most common type, and the one many people are familiar with, is Alzheimer's disease, which accounts for 60 to 70% of dementia cases. Alzheimer's is characterized by the buildup of abnormal proteins in the brain, leading to the death of brain cells and a gradual decline in memory and cognitive function. Another significant type is vascular dementia, responsible for about 20% of cases. This form of dementia is caused by reduced blood flow to the brain, often due to strokes or other conditions that damage blood vessels. Unlike Alzheimer's, the symptoms of vascular dementia can sometimes appear suddenly after a stroke, but the decline is often more step-like than gradual. Next, we have dementia with Lewy bodies, making up around 10% of cases. This type is associated with abnormal protein deposits called Lewy bodies in the brain, leading to symptoms that include visual hallucinations, movement disorders, and fluctuating cognitive abilities. It's a form of dementia that shares some similarities with both Alzheimer's and Parkinson's disease, making it particularly complex. Finally, there's frontotemporal dementia, which is less common, accounting for about 5% of cases. This type primarily affects the front and sides of the brain, leading to changes in personality, behavior, and language rather than memory in the early stages. It often affects younger people, sometimes striking as early as their 40s or 50s, which can be particularly challenging for families. It's important to understand that dementia is not a normal part of aging. Yes, it's true that as we age, we might experience some forgetfulness or slower thinking, but dementia is different. It's a serious, degenerative condition that goes beyond the occasional memory lapse. Recognizing this distinction is vital because it highlights the importance of seeking medical advice if you or someone you know starts exhibiting the signs we'll discuss later in this video. Early diagnosis and intervention can make a significant difference in managing the disease and improving quality of life. So, let's shift our thinking. Dementia isn't an inevitable consequence of getting older. It's a condition that requires attention and action. 6 early signs of dementia. 6th sign, postural changes. Let's start with a sign that often flies under the radar, postural changes. You might notice subtle shifts in the way someone stands, walks, or moves, changes in posture, gait, and coordination that are easy to attribute to normal aging. However, these physical alterations could be early indicators of dementia. As the brain's communication with the body starts to falter, it can affect the way we move, leading to unsteady walking, stooped posture, or even difficulties with balance. Imagine a person who has always walked confidently, but now they're more prone to shuffling or stumbling. These changes might seem minor, but they could be your brain's way of signaling that something is amiss. It's important to pay attention to these signs, especially when they occur alongside other cognitive issues. 5th sign, changes in sensory organs. Next, we move on to changes in sensory perception, another subtle sign that often goes unnoticed. Dementia can affect how we perceive the world around us, leading to issues with depth perception, taste, smell, and even noise sensitivity. For instance, someone might struggle to judge distances correctly, making tasks like pouring a drink or driving more challenging. They might also notice a decline in their sense of taste or smell, leading to a loss of appetite or difficulty enjoying food. Another important point is the link between hearing loss and a higher risk of dementia. Studies have shown that untreated hearing loss can significantly increase the likelihood of developing dementia, possibly because it leads to social isolation or forces the brain to work harder to process sound. If you notice someone frequently turning up the volume or struggling to follow conversations, it might be more than just a hearing issue. Fourth sign, muscle strength problems. Moving on to muscle strength, there's growing evidence that a decline in muscle strength could be an early sign of dementia, especially in women. It's easy to dismiss weaker muscles as a natural part of aging, but research suggests a strong correlation between physical strength and cognitive health. Weaker muscle strength, particularly in the legs, might be linked to reduced brain function, possibly because of the decreased physical activity that often accompanies muscle weakness. This is particularly concerning because physical exercise is known to be beneficial for brain health. So, if you or someone you know is experiencing a noticeable decline in muscle strength, it might be worth considering it as a potential early sign of dementia. Third sign, sleep problems. Now let's talk about sleep, a crucial yet often overlooked factor in brain health. Sleep disturbances can be an early warning sign of dementia, manifesting in various forms such as excessive sleepiness during the day, insomnia, frequent nightmares, or restless sleep. People might find themselves waking up frequently during the night or feeling exhausted, even after what should have been a full night's rest. Sleep is when the brain clears out toxins and consolidates memories, so disruptions in sleep can lead to cognitive decline over time. If you're noticing persistent sleep problems, it's essential to take them seriously, as they could be an early indicator of dementia. In fact, research suggests that chronic poor sleep is linked to an increased risk of Alzheimer's disease. Second sign, apathy, anhedonia. Apathy or anhedonia is another sign that can be easily misunderstood. It's characterized by a loss of interest or pleasure in activities that were once enjoyable. This isn't just feeling down or tired, it's a deeper, more pervasive lack of motivation that can affect everything from hobbies to social interactions. Unfortunately, apathy is often mistaken for depression, leading to misdiagnosis or a delay in identifying the underlying dementia. The difference lies in the fact that apathy in dementia is more about a disconnection from the world rather than feelings of sadness or hopelessness. If someone you know suddenly seems indifferent to activities they once loved, whether it's gardening, watching movies, or even spending time with family, it could be an early sign of dementia. First sign, difficulty finding words. Finally, we come to what is perhaps one of the most recognizable early signs of dementia, difficulty finding words. This can manifest as frequent pauses in conversation, struggling to recall familiar names, or even a general difficulty in articulating thoughts. This isn't just a case of occasional forgetfulness, it's a persistent issue that can make communication frustrating for both the individual and those around them. You might notice that the person starts using vague language, substituting specific words with general terms like thing or stuff, because they can't recall the exact word they're looking for. This difficulty with language, known as aphasia, can be an early indication that the brain's language centers are being affected by dementia. If you or someone close to you is consistently struggling to find the right words, it's important not to dismiss it as just a sign of getting older. Recognizing these early signs is the first step toward taking action and seeking medical advice, which can lead to an earlier diagnosis and better management of the condition. Classic symptoms of dementia. 10th symptom, short-term memory problems. One of the most common symptoms of dementia is difficulty with short-term memory. A person may forget recent events or conversations while still recalling older memories clearly. This can make daily activities challenging and may lead to repeated questions or confusion. 9th symptom, difficulty following conversations. Another classic sign is trouble following conversations. The individual might struggle to keep up, leading to interruptions, confusion, or even withdrawing from social interactions altogether because they can't follow the flow of dialogue. 8th symptom, mood or behavior changes. Noticeable shifts in mood, behavior, or personality are also common in dementia. Someone who was once outgoing and cheerful might become irritable, withdrawn, or anxious, often without a clear reason. Seventh symptom: difficulty making decisions. People with dementia often experience poor judgment and decision-making abilities. They may engage in risky behaviors or struggle with tasks that require planning and logical thinking, such as managing finances. Sixth symptom: loss of sense of time. A loss of sense of time is another symptom where individuals may become confused about the day, date, or even time of day. They might forget appointments or have trouble sticking to daily routines. Fifth symptom: repeating the same questions. Due to memory issues, individuals with dementia may repeatedly ask the same questions, even after receiving an answer. This repetition is often a sign that they're struggling to retain new information. Fourth symptom: disorientation. Disorientation is a significant symptom where someone might get lost in familiar places or have difficulty finding their way home. This can lead to increased anxiety and a need for constant supervision. Third symptom: putting objects in inappropriate places. A person with dementia may start putting objects in unusual or inappropriate places, like placing keys in the refrigerator or remote controls in the bathroom. This behavior is often due to confusion and memory loss. Second symptom: hallucinations. As dementia progresses, sensory hallucinations can occur. The individual might see or hear things that aren't there, which can be distressing both for them and for their caregivers. First symptom: urinary or fecal incontinence. In the later stages of dementia, a person may lose control over their bladder and bowels, leading to urinary or fecal incontinence. This symptom is often one of the more difficult aspects of the disease for both the individual and their caregivers. Causes of dementia. Genetics. While genetics do play a role in the development of dementia, it's important to note that not everyone with a family history of the disease will develop it. Genetic factors can increase your risk, but they're just one part of the puzzle. In many cases, lifestyle and environmental factors have a much larger impact on whether someone develops dementia. So, even if dementia runs in your family, there are steps you can take to lower your risk. Environmental and lifestyle factors. Several environmental and lifestyle factors contribute to the development of dementia. Head trauma, for instance, is a significant risk factor, particularly when it results in a concussion or traumatic brain injury. Strokes and chronic infections, especially those that affect the brain, can also increase the likelihood of developing dementia. Circulatory problems, such as high blood pressure or atherosclerosis, impair blood flow to the brain, which can lead to cognitive decline over time. Substance abuse, including excessive alcohol or drug use, can damage brain cells and accelerate the onset of dementia. Nutritional deficiencies and poor lifestyle choices also play a crucial role. Diets lacking in essential nutrients like vitamins B12 and D can harm brain health, as can a lack of regular physical activity and poor sleep habits. Smoking and a sedentary lifestyle further exacerbate these risks. By making healthier lifestyle choices, such as eating a balanced diet, staying physically active, managing stress, and avoiding harmful substances, you can significantly reduce your risk of developing dementia, even if you have a genetic predisposition. Prevention of dementia. First tip: build cognitive reserve. One of the most effective strategies to prevent dementia is to build your cognitive reserve. This refers to the brain's ability to improvise and find alternate ways of getting a job done. Engaging in mentally challenging activities like learning a new language, playing musical instruments, or solving puzzles can strengthen your brain. The idea is that the more you challenge your brain, the better equipped it will be to cope with the changes associated with dementia. This cognitive reserve can help delay the onset of symptoms, even if changes in the brain have already begun. Second tip: physical activity. Physical activity is not just beneficial for your body, it's crucial for your brain as well. Regular exercise improves blood flow to the brain, encourages the growth of new brain cells, and reduces the risk of conditions like high blood pressure and diabetes, which are linked to dementia. Activities like walking, swimming, or even dancing can make a significant difference. Aim for at least 150 minutes of moderate exercise each week to keep both your heart and brain in top shape. Third tip, quit smoking. If you smoke, quitting is one of the most important steps you can take for your brain health. Smoking damages blood vessels, reduces blood flow to the brain, and increases the risk of developing conditions that contribute to dementia, such as stroke and cardiovascular disease. By quitting smoking, you can improve your heart health, boost blood flow to your brain, and reduce your risk of cognitive decline. Fourth tip, control blood pressure and cholesterol. Managing your blood pressure and cholesterol levels is vital for reducing your dementia risk. High blood pressure and high cholesterol can lead to the narrowing and blocking of blood vessels, including those that supply the brain. This can cause damage over time, leading to cognitive impairment. Regular checkups with your doctor, along with a healthy diet and exercise, can help you keep these levels in check and protect your brain from damage. Fifth tip, manage weight. Maintaining a healthy weight is another crucial factor in dementia prevention. Obesity, particularly in midlife, has been linked to an increased risk of dementia later in life. Excess body fat can lead to inflammation and insulin resistance, both of which can damage brain cells. By managing your weight through a balanced diet and regular exercise, you can reduce this risk and promote overall brain health. Sixth tip, address diabetes. There is a strong connection between diabetes and dementia, especially Alzheimer's disease. High blood sugar levels can damage blood vessels and nerves, including those in the brain, leading to cognitive decline. If you have diabetes, it's essential to manage your blood sugar levels through diet, exercise, and medication if necessary. Proper management of diabetes can significantly reduce your risk of developing dementia. Seventh tip, improve sleep. Good sleep is crucial for brain health and dementia prevention. During sleep, your brain clears out toxins that can contribute to cognitive decline. Chronic sleep deprivation has been linked to an increased risk of dementia, particularly Alzheimer's disease. Aim for 7 to 9 hours of quality sleep each night. If you're struggling with sleep issues, consider talking to a healthcare provider to address any underlying problems. Eighth tip, improve diet. Finally, improving your diet can have a profound impact on your brain health. Diets like the Mediterranean and Mind diets, which emphasize fruits, vegetables, whole grains, fish, and healthy fats, have been shown to reduce the risk of dementia. These diets are rich in antioxidants, omega-3 fatty acids, and other nutrients that support brain function and protect against cognitive decline. Incorporating more of these foods into your daily meals can help keep your brain healthy as you age. If you or someone you know is experiencing any of the signs or symptoms we've discussed, it's crucial to seek medical advice. Early detection can lead to better management and a higher quality of life. And don't forget to share this video with others to help spread awareness about dementia. The more we know, the better equipped we are to fight this disease together. Thank you for watching, and take care of your brain health.